You know, it's kind of like 3 drinks if it starts early in the day, if I have to be there.
Okay. Anything else that you know about them in terms of anything else that they've gotten treatment for emotional, behavioral?
My mom used to get nerves.
Yeah. Okay. Anything else? Were either of them ever hospitalized or near hospitalized?
No.
No.
I know that mom would see somebody about the nerves.
Okay.
I just kind of looked at it and said, "You need a stiff shot. Smoke a joint, Mom. Chill
Yeah.
out."
Is that something that you do? Do you smoke weed?
No.
Okay, I'll go back in a minute. But the going back to where the thoughts were, where you went to the hospital. Have you ever gone to the hospital any other times?
No.
No. Okay. Do you have a therapist?
Well, the doctor sent me and said that said that this probably would help. Little happy pills.
Okay. Was this your regular doctor?
Yeah.
Or was it a psychiatrist? A
Regular.
doctor? And what was it that he prescribed?
Oh, Prozac.
Are you taking anything now? Is it Prozac?
Yeah.
Okay. Do you know how much you're taking?
20 milligrams.
Have you found that to be helpful?
I still feel like a 3.
Yeah. Okay. Do you think you felt lower before you started the Prozac?
I don't think so.
Okay.
I mean, I'm like sitting here going, I don't see it working. I've been on it for a couple of weeks now, and I'm not sure it's doing really all that good.
Okay. All right. Are you taking any other medications?
Something for high blood pressure.
What's that called?
I don't know. It starts with an S.
Okay.
I'm not sure. I just get it filled.
Okay. Are there any other medical problems that you have?
No.
Do you have any allergies to medications?
No.
Going back, do you have any side effects to the Prozac? Has there been any problems with it?
No, not that I can think of.
Okay.
I mean, it hasn't really helped me with getting any more sleep, and it's been, like I said, I'm not sure why. It's a good thing my insurance is still covering this.
Okay. Do you have a therapist?
No.
Has any medication been tried for your sleep or anything else?
No.
No. Okay. And
The doctor said it would take a few more weeks for this to like really kick in.
Okay.
But I don't see it happening.
Okay. Did you probably had a therapist at some point, right? Is that right?
Yeah, I had to talk to somebody, you know.
Was this back with the hospitalization or more recently?
Well, it's like after hospitalization, they said that I should probably continue. So I did for a little bit. And then, my doctor said I should go see somebody. I just haven't felt motivated to go see anybody else lately.
Would you try that?
Yeah, sure. Why not? Might as well milk the insurance company now while I still can.
Okay. The other thing is about your mood. Have there been times where your mood, you felt like things were great, like you were the best at things?
Yeah.
Yeah.
Yeah, definitely.
Okay. Did you ever get into any sorts of trouble because you felt so great? Like where you started to do things and not care, take things that weren't yours, or act in ways that... that surprised other people?
Not really. No, I mean, it's kind of like, well, I didn't get a raise, so they kind of owed me that.
A raise? Okay. You got one?
No. But, you know, I ended up with a new monitor. The perfect thing to go to Warlord with.
Oh, all right. How about times where people were telling you that you're talking too fast, slow down, they're not getting what you're saying, like where you're really ramped up, a lot of energy?
Not really.
Okay.
I kind of keep to myself at work too, or when I was working.
Okay. Or I know you're not sleeping well now. Was there ever a time that you didn't sleep well, but still you had a lot of energy? You just kept going. You wouldn't get tired?
Yeah, I was playing V-World.
Yeah. And would you do that 2 nights in a row with little sleep?
Yeah.
And would you crash at that point or keep going for the 3rd night?
Oh, then I just go back to work.
Oh. Okay.
Something to do on the weekends.
All right. And do you think your nerves get the best of you, or you get really nervous?
No, that was my mom's bag.
Yeah.
Getting really nervous.
Okay. Sometimes people also, their mind plays tricks on them when they're feeling down or worried about something. They might start to hear their name being called a lot and they're not sure, or see things that might not be there. Has that ever happened to you?
No.
No? Okay. When's the last time you drank alcohol?
Oh, last Saturday.
Yeah?
Dinner with the Rents.
Yeah. So they drank, is that correct?
I drank
You did?
just to not have to. It just makes dinner with them so much easier.
Okay. Well, how much did you drink?
Probably 2 whiskey sours before dinner.
Okay.
A couple of glasses of red
Yeah.
to go with the beef bourguignon.
Have you ever drank more regularly, where you were drinking a few times a week or stuff like that? No. Okay. When's the last time you think you binge drank, where you drank a lot all at once?
Thanksgiving.
Yeah. Okay.
Family time. Yay.
Okay. Any other? Have you ever taken any pills, popped any pills that weren't or were prescribed to you? Took extra or anything like that?
No.
No. All right. Ever tried any cocaine or heroin?
No.
All right. Have you? Was there a time that you were ever? Well, do you date? Do you date other people?
5 minutes.
Well, V-Life. There was V-Life was kind of like a virtual living.
Yeah.
So V-Life was fun. Yeah, I had a girlfriend on V-Life.
Okay. Or anybody else at any point that was not on V-Life or on the computer that you became close with, or?
No, not really interested.
No. Okay. Anybody in terms of anybody ever harm you in any way? Ever hit you or touched you in a way that made you feel very uncomfortable?
No.
I'm going to give you 3 things. This is a standard part of the exam that I give everybody. Okay. I'm going to give you 3 things to remember, and then I'd like you to repeat them when I'm done, and then I'll ask you them in a few minutes. Okay.
Okay.
Cup, blue, and Lincoln Boulevard. Can you say those 3 things?
Cup, blue, Lincoln Boulevard.
Okay. Can you tell me today's date?
The 27th of March.
And what's the year?
2010.
All right. Can you tell me a little bit more about, well, what do you see yourself doing? What do you see yourself doing in the future?
I don't know. I'd like to get another job. I'm gonna need another job just to get insurance, keep the apartment, to keep the cable connection.
Mm. Do you
Yeah.
see yourself being able to do that? Get another job?
This economy, I don't know. My experience has been in the construction industry, and that doesn't look any good. That doesn't really look great right now.
Yeah, some hard times. Okay. Do you ever feel like there is no future for you, where you get that low?
I don't think I'm the only one who doesn't have a future.
Really?
Yeah.
I mean, do you feel you don't have a future?
Well, I mean, construction's not coming back anytime soon. Manufacturing is gone.
Yeah.
From, I mean, what
Have you
the
been
heck do we
looking?
make?
Have you been looking at all for a job at all?
No.
No. Do you see yourself doing that at some point?
I guess I'm going to have to.
Okay.
I mean, unemployment's going to run out in about another 14 months.
All right. So there's probably people that could help you with that too, at the unemployment office or something like that, or online, Craigslist, things like that. Can you tell me the three things I asked you to remember?
Cup, Blue, Lincoln Boulevard.
Okay. Another part of this test, can you say spell world forwards?
World forwards?
Yep.
Oh, WORLD.
Good. Can you spell it backwards?
DLROW.
Good. Any group that you... It's time to stop. Oh, okay. Thank you. Nice meeting you.
Thanks.
Mr. Bob Jones is a 40-year-old male who lives alone in an apartment and is currently unemployed from a bookkeeping, counting type technical support job that seems he's lost with perhaps in part due to the downturn in construction. He says he lost his job 3 to 4 months ago and blames his co-workers and feels there's ulterior motives from his boss for letting him go. He, although he did say it happened with the economic downturn, he does blame them and feels that they were doing things behind his back to have him lose his work. Since then, he says before that happened that he was working well and that things were going pretty well. And then he denies that he was depressed, but also later, though, when asked to rate his mood, he rated his mood as very depressed and states that he has had early morning awakening, a decreased appetite with a loss of 10 pounds, decreased energy level, decreased interest, and decreased concentration. He might even have psychomotor retardation. I'm unsure, but he is staying home a lot, but he denies any suicidal ideation. He denies any elevated moods. He denies any anxiety symptoms or any auditory or visual hallucinations. He does, however, still blame those people at work, but denies any homicidal ideation, doesn't report homicidal ideation towards them, and doesn't sound as though he's planning any vengeful retribution type fantasies or anything like that at this time. He reports that he's had a period of depression back in college. When he finished college, with approximately 20 years old, his associate's degree, he at that point had an aborted suicide attempt to drive off the side of the road. He had anyway suicide